Good morning. I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is the medical tidbit of the morning. I want to touch on psoriasis because a lot of people reach out to me about psoriasis or confused about, certain skin lesions. Is it eczema? Is it this? Is it that? So I wanted to touch a little bit on psoriasis. It's a very long topic in of itself. There's a lot that we can talk about, but it's a chronic immune-mediated skin condition. All right, it can go pretty much anywhere from your scalp down to your feet. It's characterized by scaly, inflamed patches on the skin. All right, and it affects all races. All right, now in terms of it can be itchy and painful. All right, so people tend to scratch and agitate it and make the inflammation even worse, especially not knowing that it's a psoriasis. In lighter skin tones, it appears as a well demarcated red or pinkish plaque. All right, and then over that plaque, you have like silvery scales developing. In darker skin patients, it may appear differently. Okay, you have color variation. As a matter of fact, in really dark skinned people, it looks purplish, right, or dark brown, and it can even be gray rather than red. Okay, and in terms of pigmentation, it can be hyper, meaning high pigmentation, or low pigmentation. All right, and even after the inflammation and the plaques have resolved, you can have this post-inflammatory hyperpigmentation. All right, or even hypopigmentation patches on your skin, and this can be very distressing to patients. I have to emphasize the scalp involvement. Psoriasis of the scalp is common and very challenging for Black patients. All right, it's either underdiagnosed or misdiagnosed, and we tend the stigmatization. Let me put it this way: psoriasis is mistaken for eczema, fungal infections, and dismissed, and because we have this healthcare disparity, no matter where we are, in terms of access to dermatology and these types of specialists, and let's not forget systemic racism in healthcare of itself. All these things creates problem with a diagnosis like psoriasis. All right, and these lesions, they create these perceptions. It's cultural. It has this stigmatization, right? They can be misappropriated as contagious. Stay away from me, right? And that leads to social isolation on people with very bad psoriasis. Okay, and if you have all this skin discoloration, it affects self-esteem. So it really affects mental health, right? And then you have higher rates of depression and anxiety in patients with psoriasis. All right, so we have to be cognizant of these things and how we treat people, and physicians also have to address these culturally sensitive issues. In terms of management, the first line treatment is topical therapy, right, which is widely based on corticosteroids, right, steroids like hydrocortisone, all right, and you go you go to, for example, Patient Choice. We have lots of 1% hydrocortisone. All right, it's labeled. It's a white tube labeled with in red writing cortisone 10. All right, that is your first line, and what that does, it reduces inflammation. All right, and remember, stay mild on areas like the face, even your groin, the breast, and places like that. All right, there's a lot of other topical agents, triamcinolone, right? 0.1% cream and ointment is out there, and several other topical steroids that you can use. So again, talk to your doctors. Doctors talk to your patients. You want to apply this very thinly, right, directly onto the plaque, and do that twice a day. For scalp, psoriasis, which is challenging in of itself, there's a lot of shampoos, right, foams and oils that you could put in your hair that can help. And again, it's important because, our hair is very, thick. So you want to be able to get in there, but not traumatize the lesions too much. And you want to continue that therapy. There's a lot of other things out there. There's vitamin D analogs, and what that does, it slows the skin cell growth, right? And you want to, it's usually combined with the steroids, okay? So calcitriol ointment, which is called Vectical, is out there, and a few others, all right? So again, knowing these things are out there and how to use them is important. Coal tar is an old therapy, all right? Especially for the scalp. It has good anti-inflammatory and anti-scaling effects, all right? It's out there in several companies have it in the shampoo, all right? Ointments and cream. So again, pay attention to labels, all right? And there are many other topical formulations, as I mentioned before. Now, in terms of just lotioning and getting, moisturized, I would say coconut oil-based and shea butter-based lotions and good for after showering or bathing, right? They call that the soak and seal technique. Used before and during the flares to reduce the severity, all right? Now, you might read up on things like phototherapy with UVB radiation, right? And again, it's very effective, by the way, right? And black patients, because of the melanin, might require more of that phototherapy than somebody with lighter skin. But again, I can tell you it's safe and beneficial and worth the treatment if you have severe psoriasis, all right? There's a lot of other heavy hitters for systemic therapies. We don't want to get to that point, but if you need it, you have to go there. This is very high medications like methotrexate, cyclosporin. These medications are systemic agents that affects your immune system, okay? So you have to be very, very, very cognizant of that and know the side effects of these medications and how they can affect you, right? But again, you want to keep this at bay so you don't get to that point, all right? So it's important. Patient education is very key in this situation. How to use medicated shampoos, foams, and oils, and all the other topical agents that are out there. This has to be also a holistic approach because mental health is an issue here. And we as the populace have to be understanding and make this a community-based education to decrease the stigma that goes along with psoriasis, all right? And lifestyle modification, always, if you're drinking, if you're smoking, all these little things are important to improve your outcomes because, again, it's immune mediated. So the stronger your immune system, the better you are, all right? So psoriasis, especially in black people, is under-recognized and often misdiagnosed, all right, disease. And it can cause a lot of psychosocial harm to the individual. So let's be understanding of this. Let's recognize it and see that there's a challenge. And again, dermatologists and other specialists, be available to provide the needed care for these patients. All right, I just wanted to give you guys a little bit of education on psoriasis. Have a great day. I'm Dr. Dangleben. Peace.